Good afternoon, everyone. I had another question, and it was about frequent flyers. We're not talking about miles, and those I don't know much about. I don't travel too much. Wish I did. Um, this question came from one of the people in my group, Dark Secrets to Skilled Care, over in Facebook. Go check it out. Her name is Kim, and what she was wondering about was so her situation is she works in Medicare Part B, outpatient assisted living. She does some of the therapy there. Um, and she was wondering about time periods of those. I mean, a lot of those people are going to decline. It's kind of expected, especially if they have specific diseases or other processes going on. And there's just this expected decline that's going to happen. So is there a time period in which from a discharge when they had been having care, they met some goals, and then is there a discharge from when they could then be evaluated again? Um, and she was wondering what my thoughts were. Well, first, I just want to let you know, I know a fair amount about Medicare. I wouldn't call myself a huge expert. You may want to check out some other resources. Certainly CMS, their website. I do some review for these kinds of situations, so I do want to share kind of what we discuss when we do these reviews and what we're looking for. And I also want to refer you to some of the reference or some of the resources I've created in discussing skilled maintenance programs. You can look at those on my website, awittypt.com, and there's a PDF there that you can access in the shop that can kind of differentiate between the two. And that was something that was introduced in my Facebook group as well, because that's kind of what this comes down to is if someone gets to the point with their skilled care to where they're kind of plateauing, there's going to be that gradual decline, until their eventual passing or something of that nature. But they can't just continue to have care every single day up until that point. Medicare just doesn't allow that. So the basic answer is that it falls on their level of decline. Again, it's going to be function based. So still they're not progressing, but how much are they declining or how much are they regressing? So it'd be almost like a mirror image of when we are looking for continuation of care, we're looking for a standard improvement in their, whatever their measure may be, whether it's a balance test or a mobility test, reach test, Berg or Tonetti or timed up and go, sit to stand, all those things, or their level of assistance. When we're looking to continue care, we want to see that those are continuing to progress statistically, or also known as they're reaching MCID with those tests over a 4 to 6 week time period. And we've kind of talked about that before, so I'm not going to go into that a whole lot. And certainly if you have questions, post comments, we can talk about that further in depth. But similarly for a regression. So if they've hit a plateau, that patient is now on a restorative nursing program, also known as a skilled maintenance program per Medicare. And most of their home program or the activities that they're doing to maintain themselves have now been turned over to caregivers. What you would be looking for is that there is some sort of a regression that is greater than just a very gradual regression that restorative nursing program is no longer handling. And that should be something that is measurable. So it's not necessarily a period of time, right? Could be that someone, they were rehospitalized and they really declined a lot. And so their Berg or their Tonetti or their timed up and go has now regressed according to a minimal clinically important difference, MCID. If it's only regressed a couple of points, this is probably not enough to really justify changing that program. That's something that will hopefully they'll catch back up and maybe even improve a little bit back to wherever that baseline was. So hopefully that helps you out a little bit there, Kim. Again, we're looking for something that is measurable. It's not just a period of time. It's that there has been a measurable decline in that patient's status or their risk. So if they're now at a risk for falls or something, there has something that has been measured to do that. It's not just a 90 days or a 60 days. I know a lot of, depending on states or regulations, you're checking on people quarterly or every 60 days or 90 days or whatever it may be for your facility. But if there isn't a specific significant decline that is measurable, then it's probably something that you may want to watch it a little bit. But that doesn't necessarily mean that they're ready to change that program that they have been given. But it may be that they are. It just depends on what that functional decline really is. So that's kind of what you're looking for, not really a time period, looking for that function. So hopefully, Kim, anyone else that's listening, let me know what you think. Or maybe your thoughts are different. But that's generally when we're doing, where I work, when we're doing review, clinical review and the guidelines that have been established, especially the Medicare programs that we're doing review for, that's what we're looking for. And we have to abide by Medicare policy. So unless we've totally missed something and I've been led astray, we're doing what Medicare has asked us to do. And that's kind of what we're looking for. So that's what the expectation would be. Appreciate your time. Appreciate each and every one of you that watch these. Hopefully you're learning something. And talk to you again later. Thanks. See ya.